Hi, this is Dr. Diane Gayhart, and this is my lecture on Gestalt therapy and counseling to accompany my text, Case Documentation in Counseling and Psychotherapy, and Theory and Treatment Planning in Counseling and Psychotherapy by Cengage. And hopefully this lecture will help you understand the theory better so that you can apply both the case conceptualization as well as treatment plan templates in the book to your work with clients in the field. And you can also get just this single chapter available from Cengage, and there are lots of other resources, free resources available at masteringcompetencies.com. So let's start by giving you a big picture overview of Gestalt therapy. So Gestalt therapy in a nutshell. So Gestalt therapy is one of the humanistic or phenomenological approaches to counseling and psychotherapy that was developed primarily by Fritz Perls. And so this is an approach like other humanistic approaches that really emphasizes self-actualization, present moment experiencing. And the ultimate goal, like all other humanistic approaches, is to promote self-actualization, helping people become fully who they are, fully alive, particularly, and there is a great focus on being alive in terms of being in touch with one's emotions and one's experience. And so the emphasis really focuses on that people must be understood very holistically and from within their whole context. So the whole term of Gestalt refers to the whole picture very holistically, looking at both the foreground and the background. And the emphasis of many of the techniques really focus on developing present moment and direct contact with one's internal world and experience as well as with the environment. The methods are very active. They can be quite provocative and experiential. So it is not a therapy for the faint of heart, although it is very philosophically closely aligned to person-centered therapy developed by Carl Rogers. It can look dramatically different, and emphasis on the drama there in terms of it can be intense, and it is meant to be intense. It is kind of meant to kind of shake you, wake you up, to get you in touch. So it's where I often think of Carl Rogers as having a much more gentle expression of humanistic philosophy. Gestalt is a little more intense and dramatic, even though philosophically they come from very similar positions, and actually the same philosophical positions, just kind of expressed in different ways. And a lot of what the work in Gestalt focuses on this concept of unfinished business, which I really think has seeped into our vernacular language. And this is refers to actually there's actually more to it than the vernacular expression, but this need to have psychological closure to conflicts, scenarios, and relationships, and kind of this kind of holistic closure and kind of to events, difficult events usually in one's past. So, and that is Gestalt in a nutshell. So the juice, significant contributions to the field, and by this I mean a very unique contribution from the theory to the field that is really useful, or at least relevant and important to know to any counselor or psychotherapist, social worker in the field. So a very unique contribution from Gestalt therapists is this concept of body awareness. And the idea here is that emotions can be expressed and stored in the body, and that emotions have a physiological component to them. And so within the therapeutic process, what you would do with this concept is to ask clients where in their body they're experiencing their emotion. And sometimes they will add, what's the color to it? Is there a feeling or a temperature? Describe it. The physical connections to the actual emotions. And so they'll also look for things in terms of body posture, fidgeting, tone of voice, movements. So they look at all of how a person is carrying themselves and how that relates to their emotional expression or attempt to avoid emotional expression. And with this, you need to be careful. One place where I've seen this used really poorly is with someone who may be new with the ideas and kind of asking clients, so where do you feel that in your body? That, if it comes out of the blue, if you really haven't, you need to often have a very strong rapport with a person. You need to set this up in such a way that it's a comfortable question and doesn't come across as an odd or off-topic. To some people, will find that a very odd, off-topic thing. And so you want to, I think, ask this when you have a lot of rapport, when you have the type of rapport that allows you, and also the client is in a moment when they're in touch with it enough where this makes sense to them. Because if they look at you, like you've got two heads when you ask the question, you haven't set it up well in order for this to be a useful question to them. And I think it's also arguable that some people, often with different cultural backgrounds where this, psychotherapy is a very foreign concept, psychological mindedness isn't maybe as valued, that this could be a very difficult or, maybe not a useful thing for everybody, but certainly for many people, this can be very useful. And conversely, there are some cultures where it's easier to talk about the physical than the emotional. And so this may also be, a way into that. So this is a very unique contribution of the approach, but it's also one that I think you need to use with care. So now we're going to spend a moment looking at an overview of the actual approach and the various stages of Gestalt therapy. So as originally conceptualized by Pearls, he conceptualized kind of 5 layers of or 5 layers of neuroses in terms of the process of change in Gestalt therapy. And in this first layer is the phony layer, and that is when a person is governed by a lot of shoulds in their life of how they should be, what they should be doing, and trying to usually live up to these shoulds in one's life. And so this is why it's the phony layer. It's not authentically who you are underneath it all. And then there is what he calls the phobic layer, and that's when you begin to think something's not right here. I'm doing everything I should be doing and I'm not happy. And so there's this kind of beginning to question something is amiss, and so there's a little more fear that something's not quite right. So that's where the phobic is. The impasse layer is when a person begins to feel stuck. They feel like, I can't move forward. They're kind of stuck, and this is when they begin to come more open to help and reaching out in terms of being willing to take in new ideas, take in the ideas of a therapist, experience new things. That's the impasse. So then there's the implosive layer where it begins to feel like as the phony layers all begin to collapse, there's kind of this implosion where often you may feel a sense of kind of being empty inside, and you're kind of going inward, but there's this emptiness and struggle within that. But this is also the taking down of the older layers. And then there's what he calls the explosive layer, which is used not necessarily in the sense of a bomb explosion, but more or less the person is coming out. Their authentic sense of self is exploding outward, becoming more fully vibrant and expressed. And so these are the basic layers of neuroses, as he calls it. So as you're working through anxiety or depression, these are the various layers that a person goes through in Gestalt therapy. And arguably this could happen in more than one kind of place in a person's life. In terms of you might have this process related to relationships as well as maybe a work identity. So I think it's arguable that you can say that a person can go through this process more than once while in counseling or psychotherapy. It's not like you get through it once and you're all done. Check. Another way that the Gestalt process has been described by more contemporary Gestalt therapists is the integration sequence. So first there is the process of discovering disowned parts of yourself or coming to new realizations, learning to see things in a different way. So in the next phase is accommodation. And so this is where the client begins to accommodate this new perception and to behave a little bit based on this. And then there's assimilation, where you begin to make it fully part of you, shifting the actual identity, and then finally a full integration, where the new behavior is just seamlessly who the person is and becomes a natural part of who the person is. And again, this may not just be one sequence, this may happen multiple times throughout the counseling process, depending on what the client brings to the table. So making connection, the therapeutic relationship. Now, as a humanistic approach, phenomenological approach, the counseling and therapeutic relationship to Gestalt is very central to the change process, and this is very similar to person-centered therapy developed by Carl Rogers. And so the person of the therapist is central to the change process. And so in Gestalt therapy, the therapist brings himself fully as a full human being, an imperfect role model, into the therapy session. There's this great emphasis on authenticity, and in many ways I would say it's a much more 360-degree version of being human when you compare it to genuineness in person-centered, in that being angry is not out of the question, being bored with the client, not out of the question. And so they get into, they're more willing to go and embody, the therapist and counselor is more willing to embody more difficult emotions. Now certainly Fritz Perls was a master at this. It's a trademark. He was quite dramatic and in some cases extreme, if you watch some of his videos. And not every Gestalt therapist is nearly as dramatic or extreme. This doesn't mean that you need to fall asleep on a boring client, although that can be argued within this. So not every Gestalt therapist is necessarily as dramatic as Fritz Perls and his own personality was, but the emphasis is really on being fully human, fully present, and also being that imperfect role model, not trying to pretend like you've got everything just perfectly down and you have no problems. There's very much an emphasis on being in the here and now, being present, and being very, very spontaneous, and allowing that spontaneity to be part of the relationship. And often that can take on a very playful approach. There can be times where counselor or therapist would cry, if that is appropriate, but being fully human. And doing this, I think, in like I said, a more 360-degree, going to other places where some other therapists would say that's not appropriate. In Gestalt, that is part of the process and what the therapist brings to it. They talk a lot about this dialogic engagement in terms of the therapist becomes very engaged, very holistically. They often draw from the Buber's I-thou connection in terms of being a fully active, quote-unquote, subject, like a subject of the sentence, but two subjects rather than an I-it encounter. You are a client and I am a therapist. This is much more, we are two subjects trying to honestly and genuinely connect in a very profound level. They also, some Gestalt therapists use the concept of confirmation and inclusion, and so confirmation is confirming of the self, but there's this concept of inclusion where the therapist really feels into the client's world in a way that's similar to empathy that we talk about in person-centered or other approaches, but much more, I guess, intense might be a better word, where you're really feeling into the client's lived experience and feeling, taking on more fully the client's emotions, not just perceiving the emotional terrain, but actually entering that emotional terrain. And so it is a much more engaged version of doing humanistic therapy. And so it is a very unique and often very intense therapeutic relationship. Again, to summarize and repeat, it does not need to be always dramatic or harsh, but it is definitely very, very real, very authentic, and very kind of 360, engaging what it means to be human with all of our wondrous sides and also our very more difficult and challenging emotions and experiences. So now we're going to move on to case conceptualization in Gestalt therapy. There are many ways that Gestalt therapists conceptualize their work with clients. One of the first ways is this concept of the figure and ground, and that's where the original term came from Gestalt. So what is the figure, what is the focus on, and what is the background, what is the context of whatever that might be. And more recently, Gestalt therapists actually use a field theory as an extension of this, where they begin to realize that the foreground and the background are actually interrelated and affecting one another. And so when discussing whether it's a thought, an experience that emerges, that becomes the foreground, realizing that that is intimately connecting and affecting and shifting the background also as those things emerge in and out of consciousness, whether it's thoughts, feelings, and experiences. So that's assessing the field is about identifying what is in consciousness and what is the background or the field for that also. They also look very close at what they call contact boundaries. And what they refer to as a contact boundary is, where the organism, the person, fully embodied organism, they mean it as I say it, encounters the environment. And so how are we encountering the environment from physiological level to an emotional level? And so they talk about there's 7 different phases to this, and a person can have resistance at each of these phases. So there's just sensing it, letting the perception, the physical embodied sensation, can be needs to be sensed, and so resistance to this is when you just become desensitized. You fail to recognize it. Then there is the awareness, so where one's experience becomes focused on, and you're noticing this sensation, engagement with the environment. And the environment can be another person that you're dealing with, a situation, external situation, anything in that category. Looking at excitement, mobilization, so the organism needs to mobilize and to respond for contact with the environment. And so there are ways that you can use projection as a way to deflect and resist that process actually. Looking at the actual encounter, so taking action and doing something, and then you have the interaction, the full contact between the organism and its environment. And again, it's another place where a person can avoid direct full contact. Then there's assimilation and integration with the organism and with the environment, and then finally the differentiation and withdrawal, so being clearly separating from whatever that might be. And so they do have a kind of complex, and there's more detail in this in the book, but they do have a complex system for assessing where a person can get stuck in any one of these 7 phases. Another area that Gestalt therapists often discuss in conceptualization is what they call polarity or disowned parts. And this can actually be fun, but this is often what they say is when we construct our identities, we often become polarized, and there are certain parts of ourselves that we disown, and this often becomes very problematic. Like you can have your social self versus a natural self, or your adult-like self, your adult self and the childlike self. The perfect self and the self that isn't perfect all the time. The emotional self and the logical self, and the shallow self versus the deep self. And so there are many different ways that we can experience these polarities within ourselves, and the more rigid they are, the more problems we have. And the more we disown different parts of ourselves, the more stuck we become. And so the therapist helps the client to identify these various parts of self so that they can more effectively engage in their environment and to be more authentically, fully who they are. Another thing that Fritz Perls and Gestalt therapists had a lot of fun with are the shoulds. Don't should all over yourself. And so again, when Gestalt therapists just listen to clients talk, one of the first things they're doing is listening for all the shoulds that limit their life and limit what they believe they should be doing or shouldn't be doing, and limit their activity and limit their ability to be fully who they are. And so there's a lot of emphasis on the shoulds and listening for those. And as mentioned earlier, a lot of the focus is also on the unfinished business in a person's life, where they feel stuck, where they feel resentment, where they don't feel free and light, for a better way of saying that. And so these areas of unfinished business also often hold people back and even get them stuck in their lives. And so it's very hard to be fully authentically yourself if you're feeling kind of stuck or trapped by past guilt or resentment. That kind of keeps you stuck. So that's another area that they will assess for and address. So now we're going to move on to talking about setting goals in Gestalt therapy. So Gestalt therapists' overarching goal as a humanistic approach is self-actualization, which is a very broad goal. And so that you can, when actually writing treatment plans and such from a Gestalt approach, it helps to have some little goals along the way to help you to the kind of really lifelong goal of self-actualization. So one of their early goals here is to just increase awareness in certain areas of a person's life. So it might be related to relationships or work, but just increasing awareness in any part of facet of their life is always a goal in a Gestalt approach. And read this next one carefully: organismic self-regulation. So another area here is helping the organism, the person, self-regulate. And this use of the term organism, which is not common in the field of psychotherapy and counseling, is intentional. It's because they see us as fully embodied. We are flesh. We are animals. We are organisms. Obviously we are human too, so we have thoughts and emotions, but we're more than just thoughts and emotions. There's a whole body that's interacting with all of those thoughts and emotions. Most psychotherapies do really focus on the mind, or the psychology, mind, thought, and emotions, and the Gestalt therapists really focus on the holistic piece of it all. So organismic self-regulation has been enabling being able to self-regulate your thoughts, your emotions, even your ability to physically sense things, to have full contact with others, with life experiences, and to become fully alive. And learning how to self-regulate in terms of your managing difficult emotions. I mean, the reason most of us are not fully in contact with our environment is that it can feel yicky, painful, trigger lots of emotions. And so you need to be able to self-regulate in order to fully engage life. And so this term, organismic self-regulation, is part of the overarching goals in Gestalt therapy. Accepting what is also part of the goals. And so this is kind of a paradoxical theory of change, that by accepting what is, things change. And the reason for that is that, once you accept perhaps that your partner is a certain way, or, you are, let's say, not as, you're more forgetful than you would like to be, or, or even accepting that you can be mean in a way that you never thought you could be, accepting that you can do that or be this way. When you accept it, paradoxically, you open up new ways and a new sense of choice. For example, if you're in full denial that you ever say anything mean to anybody, you are more likely to say mean things to other people. Once you accept fully that, yeah, I can say some pretty mean things, then you're more likely to be open to making a change in that area. And so there is, and again, it's accepting what really is in life, who I am, what life is. Another example of this is if you're in a relationship with someone who beats you, accepting what is that the person you love most also hurts you in ways that are quite horrific and most likely unacceptable to you. And so that is what is. It's very difficult. And when you accept both parts, those contradictory, conflicting realities, both within yourself and externally, paradoxically, you are more likely to do something different, whatever that might be. And so this concept of accepting what is has also been reintroduced to the psychotherapy literature through the work with mindfulness, and along with the ideas of self-regulation. So there are also many Gestalt therapists who work with mindfulness, because there are some concepts in mindfulness that kind of link up to some of these Gestalt concepts. And then finally, just the idea of integration of polarities, being able to embrace both your serious side and your fun side, your high performing side, and the part of you who's able to really relax, the part of you that might be social in some ways and less social in others, or whatever it might be, those different polarities within us, to be able to integrate, embrace all those different sides. Because the experience of being human, we are not linear logical machines that only have a limited set of possibilities. We are multifaceted. We are complex. There are contradictory emotions, experience, and parts of our beings. And learning how to integrate these effectively allows a person to live more fully. And so you can imagine then it is a goal of Gestalt therapy. So the doing, interventions. So Gestalt therapy, you're going to find, has a lot more concrete interventions, I would say, than many other humanistic approaches. Gestalt is very much a process-oriented theory, just like person-centered or even existential, but there are a lot more active interventions. It's a very active approach. So if you like to have concrete interventions to do, there's a lot of that in Gestalt. And so the interventions we're going to talk about in this lecture, and there are certainly more beyond what is listed in my textbook, are the body awareness, which we actually did talk about in the juice above, the Gestalt experiment and empty chair, the semantics and the modification of language, staying with feelings, and dream work. The empty chair technique is really a signature Gestalt technique that I think many of us have seen in Hollywood movies. And similarly, the Gestalt experiment is getting your client up out of their seat, or at least moving around, usually moving their chair around, and doing something active. And the way some people describe this as it's asking the client to take action in the room by creating a quote-unquote safe emergency. This should give you a good sense of the feeling of a Gestalt session. And so what they're doing in these experiments and empty chairs is they're allowing the client to actually experience acting and speaking from their immediate lived experience. And so this can take many forms, whatever the therapist kind of spontaneously may come up with what might be useful. But, you can have the person do an empty chair where, the empty chair may represent, you may, put a deceased person or a live person in that chair that they're afraid to speak to or wish they could have said something to have them speak to that. You can actually have them answer, have them get up and move chairs to answer. You can do having them actually put in the empty chair a disowned part of themselves that they never wanted to, that they don't let out, they don't let anyone see. You can do lots of anything that kind of seems like it will allow the client to engage with often disowned parts of themselves, difficult relationships, being able to practice saying things they're afraid to say, practice ways of being that they're afraid of, and so that the client actually experiences it in vivo. And for many people, it does feel like a emergency, a crisis. For some people, it's very difficult to do these. It can be very intense. There can be a lot of tears. It can be an intense, they're meant to be intense. And that's part of Gestalt, is not afraid about being intense. Life is intense. And so they invite clients to do this so they can kind of break through, those various layers to have authentic, real contact, or at least, practice that, even if you're talking to that, imaginary person over there. But these can be quite powerful. And again, the setup is key. If you kind of ask clients to sheepishly do this because it's a good, technique you read in a textbook, most clients are going to roll their eyes and not engage. But yet, if you believe in it and you can set it up and get have the rapport with the client, most people will do it. And it has a lot to do with the quality of the relationship and how much the clients trust you, whether or not they're open to having this quote unquote safe emergency. So another technique regularly used by Gestalt therapists is language modification, and really looking at the semantics and the assumptions and how people are using language to describe their reality, and there are all these hidden shoulds and using I statements rather than it statements, and so this can be annoying. And again, clients are not going to respond well to it unless you have a good relationship, because stopping someone mid-sentence to modify their language is, in everyday conversation, annoying and almost rude at times. So you have to be aware of this when you do this, and so you have to do it gently. You have to have the rapport where you can interrupt and have them go back and relook at something. And so this is something that you just don't march in and do again. It does take us a lot of rapport and framing it, and you'll know if you don't have the rapport, haven't framed it right, because often clients will have more of the social normal response, which is, that's kind of rude, you're just interrupting me, and they will not necessarily respond well. So, but the purpose of the modification is to really highlight their autonomy, choice, responsibility, to help free them from all the shoulds in their lives. And so things you might do is, instead of having them turn questions to statements, or statements to questions even sometimes, you having them use I statements rather than it statements. And so having them own what they're saying, seeing. So when they say, I just can't do something, to have them, go back and say, no, you're choosing not to do something because you're choosing to follow your rule about what you should be doing. So you can do it, but you're choosing not to because you want to follow this rule. And that's, as long as they're conscious and choosing it and aware of it, they can choose what they want. But the point here is to emphasize that there is actually freedom, but you have a rule that, because of that, you want to honor that rule, you're not exercising your freedom. Then there's also the, saying that you want to do something versus you have to. Again, it's very similar. People often feel like, I have to do blah, blah, blah. It's, no, you want to do X because you want to follow that should and get the benefits that come from that. And so, working with clients so that they realize that there are choices here. And so again, often doing the same thing with but and to help them see how they're actually constructing a lot of what they're calling their problem, and making choices so that these problems arise, and their sense of not feeling like they have freedom is very much because they have chosen to live by certain rules. So another thing that Gestalt therapists will do is, when a client is beginning to engage difficult feelings or feelings that have been avoided, they will coach the client really through how to stay with and fully experience these very difficult emotions. So, and often through this process, they will have them describe where they're feeling it and how they're feeling it, and kind of talk about, what it is like to experience these, where and how they're feeling them, and kind of coach them through having and engaging very difficult emotions and experiences. And again, it's a variation on having a safe emergency, or creating a safe crisis, which very much characterizes the work of Gestalt. So as I said at the beginning, this is not for the faint of heart. If you've been trying to avoid thoughts, feelings, and emotions, the Gestalt process will guide you to them. Now, the Gestalt therapists actually work with dreams, and they have a very unique approach that's very distinct from the psychodynamic approach or Jungian approach to dream work. They actually conceptualize each character, object, in the dream as a part of the self, and maybe a disowned part of the self. And so, each character in the dream, it might be, the monster, the, empty house, feeling that's feeling like you're being chased, that they would, look at what that, monster, what part of the self that monster might represent, what part of that, if there's a hero, that hero might represent, and to look at how the dream can be understood as each part of the dream representing a part of the self. And this is actually a really fun and fascinating way to analyze dreams, because oftentimes the surface level may have one meaning, and then when you analyze it this way, it has a very different perspective on what's going on in the client's life. So this can be a really fun way to analyze dreams for clients. So now I want to talk a little bit about the research and evidence base for Gestalt work. So Gestalt therapy does not have a lot of direct research on its effectiveness for treating, let's say, anxiety or depression. Overall, its strongest research base comes from the common factors model that talks about having a empathetic relationship with the client. And so this whole emphasis on the quality of the therapeutic relationship being strong is supported, largely by the common factors model, and the humanistic approach is largely supported by that. There is an exception here, which is the empty chair technique. And there is research on the effectiveness of empty chair, or the quote-unquote two-chair technique, when you take it out of the Gestalt world. That's a generic name for it. And there are some studies that have actually even compared the empty chair to traditional kind of empathic responding to clients. And some studies have actually shown that the empty chair is a much more powerful technique, resulting in more awareness, which one might imagine it is a bit more intense. So there is some research on the empty chair technique, but the approach as a whole has not been studied in terms of its effectiveness on specific problems that clients might bring to therapy. And finally, I want to talk a little bit about using Gestalt therapy with various diverse populations. Now, as you might imagine, Gestalt needs to be used cautiously across cultures. That said, Gestalt therapy is used around the globe in Europe, North America, South America, Asia, Australia. So it is used around the globe. And so, that said, you need to make sure that this approach is appropriate and works for the client that you are particularly working with. And you need to consider, especially in terms of expectations of emotional expression and range of emotional expression, and because emotional expression is very much a culturally prescribed and gender prescribed, and it can be prescribed across professions, such as military professionals, for example, have a certain range of expression that is allowed within their career and their position. Social economic class even has different ranges of acceptable emotional expression. And so you need to keep all of these factors in mind when working with clients. And so another thing to keep in mind here is that there's this focus on the individual's subjective experience and their subjective reality. And there's also very much embedded within Gestalt, as a humanistic phenomenological approach, many Western values that align with more individualistic values in individualistic cultures versus collectivist cultures. And so wanting to become more fully who you are is very much an individualistic value, and it can be directly at odds with values from other cultures that value the community and family and relationship above individual values. Now, that said, what that means is when working cross-culturally, working with individuals who value this, and it's even arguable that even just female values within Western European culture, or Western, American culture, female values value often more relationship above individual needs. And so it's often important to have very upfront, direct conversations with clients about these what might be conflicting values, individualistic versus collectivist, and to use these conversations to allow clients to have conscious decisions about where they want to choose to embody one set of values versus another. They get to choose, and so that's a very important process if you're going to be working cross-culturally with this approach, which can be quite intense. And that said, there are certain there in the literature there are certain cultural groups that they've talked about using Gestalt with very successfully. For example, there is some work with Asian Americans, specifically with the empty chair technique, and that seems to be very culturally consistent in that it addresses the issues of shame, the fear of losing face, allowing people to kind of resolve unfinished business in areas around guilt and conflict in a very safe way that actually still works within cultural norms. There's also been some work about Gestalt counseling in Australia and how these views of engaging life and this kind of the organism and engaging the environment very much fits with Aboriginal views and ways of life that this has been used. So certainly Gestalt work can be worked across cultures, but it certainly is not... should be done mindfully and thoughtfully and aware of the values embedded within the theory, as well as our expectations for emotional expression across gender, culture, and other areas of diversity. And finally, I just wanted to talk a little bit about using Gestalt therapy with sexual identity issues and minority groups. And specifically, the most work I found was in working with gay men. There is work on using Gestalt therapy with gay men in the coming out process. And if you go back and look at the process of therapy, as Pearls describes it as, the phony layer moving to the phobic, and the various phases down to the explosion, very much actually is a coming out process. And Gestalt, Pearls originally imagined it as becoming your fully actualized self, and that has, of course, a very meaningful and poignant for someone who has a gay identity. And so they have used this model to conceptualize the coming out process. And it's also been used in terms of working with gay male survivors of domestic violence. And so again, you want to be careful in terms of adapting these ideas, but there were, in the literature you'll see many parallels between kind of the self-actualization process that is described in the Gestalt literature, seems to apply very nicely to the coming out and other process in the GLBTQ literature. So hopefully this has been a useful introduction to Gestalt. It is a very, fun, engaging, active approach, and I invite you to learn more about it by reading my text and everything else you can get your hands on.